Hello, this is Alan Franciscus with an HCSP Advocate video update. And in this update, I'm going to be talking about top-line results from 3 phase 3 studies that involve boceprevir and telaprevir. I am the Executive Director of the Hepatitis C Support Project and Editor-in-Chief of the HCV and HBV Advocate website. And if you'd like, you can also follow us on Twitter and Facebook under HCV Advocate. And just recently we launched a blog that we're going to be providing more timely information, and it's going to be a great way if you want to leave comments or ask questions, how we can answer those for you, or just hear about what you want to say. So I really encourage you to visit that and get to know it. So the first 2 studies are from the phase 3 studies of boceprevir. And in boceprevir, there was 2 studies. One's called the SPRINT-2 study, and the other study is called the RESPOND-2 study. And in both of these studies, a triple combination of boceprevir, pegintron, and ribavirin was used. Now, the first one we're going to talk about is SPRINT-2. And in SPRINT-2, there was 1,097 HCV genotype 1 treatment-naive patients. And what that means is that patients that have never been treated. And in this study, as well as the other study, there was a 4-week lead-in phase that included pegintron and ribavirin, but without boceprevir. This was followed by a continuation of treatment with the triple combination of boceprevir, pegintron, and ribavirin. Now, these studies, in fact, all of these studies were really guided by a treatment response. It's important to know that in SPRINT-2, there was about 159 African American patients, which comprised about 15% of the patient population. It's also important to know that if patients were HCV RNA positive, or if they had a viral load, at week 24, all treatment was discontinued. Now, as with all of these studies, the success was defined as people who achieved a sustained virological response, or SVR. And what that is defined as is people, of course, while they're on treatment, they go HCV RNA negative. But if you're still HCV RNA negative 24 weeks after treatment was stopped, then that's considered an SVR or a viral cure. Now, in the SPRINT-2 study, the use of procritter EPO was allowed to treat the side effect hemolytic anemia. Now I'm going to break this down by the 3 different groups or arms in the study. The first arm was Group A, and in Group A, the definition of response guided is that if HCV RNA was undetectable at week 8 through week 24, total treatment duration was 28 weeks. The overall SVR rates for Group A were 63%, and in the proportion of patients in that study that were African American, the SVR rates were 42%. Now the next arm, or Group B, they defined response guided as if HCV RNA or viral load was positive at week 8, but undetectable at week 28, pegintron and ribavirin were continued for a total treatment duration of 48 weeks. And in Group B, the overall SVR rates were 66%, and again, the proportion of African Americans in Group B that were treated achieved 53% achieved an SVR. Now, Group C is the control arm, which people were just given standard of care, which is pegintron and ribavirin, and plus a placebo or sugar pill. And the overall SVR rates in Group C were 38%, and in African Americans that were included in Group C, the SVR rate was 23%. Now moving on to the other study, RESPOND-2. In RESPOND-2, there was 403 HCV genotype 1, and the definition or the term used on the press release was treatment failure. We don't really know what they mean by treatment failure, if it was people that had a prior non-response or a prior null response or a prior relapse response. But that information I'm sure we'll learn more about in the future. And it's actually very important information. Now, as with the Sprint 2 study, this had a 4-week lead-in phase that included peg-intron plus ribavirin, but without boceprevir, and that was followed by a triple combination of boceprevir, peg-intron, and ribavirin. And this study was also guided by treatment response. And as with all studies with hepatitis C, the success is defined by the number of people who achieved an SVR, sustained virological response. This study, the use of growth factor EPO or Procrit was also allowed for the treatment of hemolytic anemia. And it's important to know in this study that if patients were HCV RNA positive at week 12, all treatment was stopped. Now, breaking this down by the 3 different groups, in Group A, if HCV RNA was undetectable at week 8 and week 12, the total treatment duration was 36 weeks. The SVR results in Group A were 59%. In Group B, if HCV RNA was positive at week 8 but undetectable at week 36, the combination of peg-intron and ribavirin, this is without boceprevir, was continued for a total treatment duration of 48 weeks. And in Group B, there was a 66% overall sustained virological response. And in Group C, which is the control arm, and again that is the standard of care, a combination of peg-intron and ribavirin, but with placebo, the total treatment duration was 48 weeks, and sustained virological response was 21%. Now, in both of these studies, the side effects were similar across all treatment arms, except the incidence of anemia was anywhere from 20 to 27% higher in any of the arms that included boceprevir. But it's really important to know that even though with this increased anemia, the discontinuation rate between all the arms was similar. And this is most likely due to the fact that EPO or Procrit was actually allowed in the studies to treat the hemolytic anemia. Now, putting this all together, the results, although top line, they're really impressive and encouraging for people that are waiting around for treatment. Of course, if you need treatment now, you shouldn't wait because we don't really know when these medications will be approved. Merck Shearing has indicated that they will be filing for marketing approval in the United States and Europe by the end of 2010. And so we're looking at probably 2011 as a best case scenario for approval of the medications, maybe 2012. Now, more information about these 2 studies will be released at AASLD, and that conference is going to be held in Boston at the end of October. Now, the next study I'm going to talk about is the telaprevir study, and that telaprevir is from Vertex Pharmaceuticals Incorporated, and this is also a phase 3 study. And this study is called Illuminate, and Illuminate is using telaprevir, pegylated interferon, and ribavirin in people with HCV genotype 1 that have never been treated with antiviral medications for hepatitis C. Now, it's also important to know that telaprevir was not given for more than 12 weeks. It's also important to know that Vertex has multiple phase 3 studies, and some of the top-line results have been released. A more complete data set is expected to be released at AASLD conference and next year. If you want to keep up-to-date information about all these drugs that are being tested to treat hepatitis C, we have our HCV drug pipeline, which we update about once every week or 2. So stay tuned for that and check that out, and let us know what you think. Now, in the Illuminate trial, there was 540 genotype 1 treatment-naive patients, and the aim of the study was to find out if it was beneficial to extend treatment duration from 24 weeks to 48 weeks. It's really important to know that in this study, the use of EPO or Procrit was not allowed. This study was also guided by treatment response, so if patients were HCV RNA negative at week 4 and week 12, patients were randomized at week 20 into 2 arms for a total treatment duration of either 24 or 48 weeks. when you look at the overall sustained virological response rates, that was about 72%. Now, when patients were guided by the type of response during therapy, what that means is if they were HCV RNA undetectable at week 4 and week 12, there was an 88% response rate in people that were treated for 24 weeks, and 92% response rates that were people that were treated for 48 weeks. Now, across the arms, the discontinuation rate was 6.9%, which was similar to the rate seen in current standard of care pegylated interferon and ribavirin. Now, the authors conclude in this study that treatment duration of 24 weeks is as effective as 48 weeks. Also, know that the top-line data from the REALIZE study, which is the retreatment of people who have failed to achieve an SVR with the previous course of therapy, that data is expected in September or next month. More data on these and other studies is expected to be released at AASLD conference at the end of October in Boston, Massachusetts. So thank you for listening to this. I hope it's been helpful for you to understand some of the data. Again, it's top line from company press releases, so stay tuned for more complete data through the rest of the year and into next year. Thanks.